Hello, Lucy Andrews here, home care nurse and owner of At Your Service Home Care. Well, today we're going to be talking about the second most frequent question that I am asked. The first being, does my loved one need care? The second question is always, how does that care get paid for? Who does pay for it? Well, today we're going to go over those options so you have a little bit better understanding of what you might need. The first payer is Medicare, and Medicare services are funded obviously by the government. The issue with these is that you must qualify for services. So they must be ordered by your physician. You must need skilled services, those services of a nurse, physical therapist, or speech or occupational therapist. So you must qualify for these. The other big qualifying criteria is you must be homebound, meaning that you're not able to leave your home in order to get care at a medical center or a physician office. So this service, Medicare, is pretty narrow in how it's funded. It's intermittent, meaning it is not long-term care, and it's usually after some type of episode has happened. Either you've gone to the hospital, had surgery, or maybe taken a spill. The second kind of funding for this is private insurance. If you don't qualify for Medicare, whether it be age or that you don't have Social Security, Medicare, oftentimes private insurances such as Kaiser or the Blues will pay for services. Again, these services must be written and ordered by a physician. They must be skilled in nature, meaning that nurse, physical therapist, or the like, providing the care, and they are again short-term. The third option for people are state-funded programs. Now, these have a different qualifier. These have a financial qualification, and you must spend down or meet the minimum qualifications to utilize these services. These are typically Medi-Cal services in California. So the best way to find about these is to ask a social worker at the hospital or a discharge planner if you're leaving a facility. They can help you see if you can qualify for these types of services. The last and probably most popular are private pay services. So these are services where you don't need a physician order and they're not skilled in nature. So they're companion care. They're helping doing the things that many people just need to stay at home. Things like bathing and dressing and grooming. Those are the services that are provided when you use a home care aid agency and you pay for the services yourself. Now, you may have long-term care insurance, which can help you pay for these, or there are some other alternatives that are available, such as reverse mortgages, and those you'd really need to talk to your accountant about. But these services are usually best started after you have an in-home assessment from a home care agency that's a reputable one in your area. They offer this as a free service, and they can help you determine which of these payers you might qualify for. I hope answers your questions today about how do I get these services paid. This is Lucy Andrews at Your Service Home Care, signing off for today.